Welcome to the product instruction video of the HITAlert kit. We will go through all the steps of the protocol and points of attention. Test procedure HITAlert. First, dissolve reagent C, calcium ionophore, in 200 microliter 70% or 96% ethanol. This is the stock solution. Mix the reagent C well by vortexing and end over end. Reagent C needs 15 to 30 minutes to dissolve completely in ethanol. Preparation of platelet-rich plasma. Collect venous blood of an O blood type donor into a citrate tube. Spin the blood 5 minutes at 100 G with low acceleration and break off. Collect the upper yellow fluid. This is the platelet-rich plasma. Stay well above the red and white cell pellet. Prevent unnecessary shaking. Processing the blood sample. Collect serum from the patient. Frozen serum should be spinned before use. Sample incubation. Perform the first incubation step in 2.2 milliliter polypropylene vial with a wide bottom. Perform the assay by adding together the following components on the bottom of the 2.2 milliliter vial. Assay sample 1 is platelet-rich plasma with heparin. Assay sample 2 is platelet-rich plasma with calcium ionophore. Assay sample 3 is platelet-rich plasma with patient sample. Assay sample 4 is platelet-rich plasma with patient sample and heparin. Assay sample 5 is platelet-rich plasma with 100 units per milliliter heparin solution. Mix the suspension carefully by pipetting up and down. Avoid generating air bubbles. Abrupt shaking will decrease the reliability of the assay. Incubate the tubes at room temperature on a horizontal orbital shaker for 1 hour. Staining of the samples. Making a master mix with all ingredients for staining will save you some time. Label 5 tubes suitable for the flow cytometer with 1, 2, 3, 4, and 5. Add reagent D, E, and F to the tubes following Table 2. Store the tubes in the dark before use. After the 1 hour incubation of the samples, add 5 microliter of the assay sample mixture to the corresponding tubes with staining solution. Adjustment of the flow cytometer. Label 3 tubes with S1, S2, and S3. Add the different components to the tubes following Table 3. Make sure to add 5 microliter platelet-rich plasma to the tubes S1 and S2 and 5 microliter assay sample 2 to tube S3. Mix the tubes carefully by pipetting up and down. Incubate 15 minutes in the dark at room temperature. Add 400 microliter reagent D to each tube. The cells are now ready for acquisition and evaluation by flow cytometer. Setting up flow cytometer protocol. Generate 3 dot plots. First, a forward scatter, sideward scatter dot plot with logarithmic scale for selecting the platelets. Second, a PE sideward scatter dot plot for selecting the platelet marker. Lastly, a FITS PE dot plot to determine the activation of the platelets. Adjust the forward scatter, sideward scatter voltage with sample S1. Gate the platelets to exclude all debris and background noise. The negative population should be set in the lower left corner, S2. Activate the gate from the first plot and the second plot. Select the PE with a new region. Samples S2 and S3 are used for the compensation. Activate the gate from the second plot in the third plot. Use sample S3 to adjust the compensation of fits from the PE channel. Use sample S2 to adjust the compensation of PE from the fits channel. After adjusting the settings, the assay samples can be analyzed. Analysis sample. Negative control. Positive control. In this patient, it is 99.4% without heparin. In this patient, it is 2.4% with heparin. In this patient, it is 20.2%. Extra control with 1,000 units heparin per milliliter. We hope to have given you a better insight into IQ's HITAlert kit.